Okay. Hello everyone again. I am Cyrena Guluga. I am the Director of Research for the Preparedness and Treatment Equity Coalition. And we are having another interview today with one of our grant recipients for the 2022-2023 Health and Equities Research Grant Program. And with me is Renea Duffin. Is that correct? Do you mind introducing yourself for us and where you work?
My name is Renea Duffin. I am Vice President for Cancer Support and Outreach at Mary Bird Perkins Cancer Center, located in Baton Rouge, Louisiana.
Mhm. So could you tell us a little bit more about Mary Bird Cancer Center and what you do there?
Sure. Mary Bird Perkins Cancer Center is a nonprofit cancer treatment center that has been in existence for over 50 years. We started primarily as a radiation therapy facility. We have expanded and grown throughout the years, and we now also do infusion, chemotherapy, medical oncology services, and we have a comprehensive community array of programs, which includes our mobile screening program that we've operated for over 20 years.
Mhm. So what population does your center serve?
So our center serves everyone, regardless of ability to pay. We Through our outreach program and our mobile screening program, our primary target audience is our uninsured and our underinsured. Over 20 years ago, our board of directors recognized that we had a lot of individuals showing up for cancer treatment who had a late stage of diagnosis of their disease. And so, in an effort to reduce that, we recognize that prevention, education, and early detection is the key to catching cancers at their earliest stages where they have their greatest probability of being treatable. And so we started targeting the uninsured and the underinsured for our education, outreach, and early detection program.
Mhm. So how long have you been with Mary Bird?
I have been an employee of Mary Bird Perkins for 16 years.
Mhm.
But 2 years prior to my coming here, well, I shouldn't say that, probably about a year and a half prior to my coming here, my sister was treated for breast cancer at this center.
Ah, okay. Okay.
And I would bring her for treatment. And I always thought, what a great place to work because everyone lived the mission, not knowing that I would end up being a long-time employee.
So it sounds like you have pretty strong investment in the work that the Mary Bird Perkins Cancer Center does.
I
So what, I guess, so it sounds from what you described, particularly with your mobile screening unit, that health equity is a really integral part of the work that you do there at the Mary Bird Perkins Cancer Center. So could you talk a little bit more about the uh, research initiatives that you have going on there and how that ties into the really important part that health equity plays in your services?
Sure. In Louisiana, we don't necessarily have more cancer than any other state. But we tend to die from cancer more here in Louisiana. And there are a number of contributing factors to that. Um, for many, many years prior to the Medicaid expansion, several years ago, we had one of the highest uninsured rates in the country. Approximately 25% of our adult population was uninsured. We have very low health literacy rates here. We have low education rates here in Louisiana. We have a significant portion of our adult population that use tobacco, excessive drinking, and we have a large number of individuals that have an extremely high obesity rate.
Mhm.
And so when you combine all of those factors, it does lend itself to individuals having a greater risk of developing a cancer. In addition to that, research has shown that a significant portion of our adult population who develop cancers that more minorities tend to die from those cancers than non-minorities here in Louisiana. And so our program is designed to address those inequities by providing access at the local grassroots level. We actually go into communities where people live, work, worship, and play, and provide them with these early detection and education services. So they don't have to seek out a brick and mortar facility. We take the program directly to them.
Oh, that's very interesting. That's really important. It sounds like, I mean, we use this term very freely, and we see it more and more everywhere, and it's also almost become a buzzword. But the social determinants of health are such a critical part of the sort of the cancer landscape that you're dealing with. I mean, you're right. I don't think that the rates are any different. It's just sort of the journey is very different from perhaps it would be where I am, which is Rhode Island, where we have, so much healthcare all over the place. Obviously, having the availability is not the same as access, but it's a very different environment.
Right.
So you're able to take the services into the community. You also mentioned something important, which is the education that is really important for people even to recognize that they need to go and seek some sort of services and support for something that they may overlook because of time, because of resources, or lack of knowledge. So the research that you proposed for the grant that we're funding, do you talk a little bit more about that?
Absolutely. But one thing I do want to add to the conversation around social determinants of health is that research has also shown that there are a number of toxic stressors that impact certain minority populations at a much higher level, in addition to those social determinants of health that prevent them from having good health. I read a recent quote that said, when you're Black in America, you cannot buy good health. You may have good health coverage in the form of insurance, but you cannot buy good health. And it's due in part to a lot of those additional toxic stressors that we as a race of people have to contend with and deal with on a daily basis. And so in our work, knowing is not enough, we must apply, and willing is not enough, we must do. And that's a quote by Ghost that we tend to look at, because it's important to know. You have to first know that you need to be screened. Then you have to want to be screened, and then you have to seek that service out. So with the research that we are doing with our PTEC grant is looking at another population of people that have been marginalized in our community, for which we do not have a lot of data, and that is the LGBTQ plus community. And so we want to look at what is the most effective approach to reaching individuals from that community in order to help them be educated about the importance of being screened and then being screened in an environment in which they consider to be a safe environment. And so what are the various and different approaches that we should take in our efforts to reach that population, to educate them, and then get them screened?
Okay. Now, are there particular cancers that are of greater interest when you're working with the LGBTQ plus community? Because I know that there can be some differences in terms of screening, particularly for reproductive cancers, for example, or breast cancer for women, cisgendered women who are in the community.
There are, and again, we're just starting our work in this effort, but helping to educate the trans community on understanding how the gender in which you were born is different than the gender in which you identify as now. But if you maintain or retained the organs with which you were born, you need to be screened for those. You need to have those screened where possible, where screening is accessible. And so helping them to understand that. In one of our first community advisory meetings we conducted with the LGBTQ plus community, we heard a resounding amount of feedback from them that a large number of them did not know what the screening guidelines are, when they should be screened, for what should they be screened, and how those screenings are conducted.
Mm-hmm.
So there's just a basic education that needs to be provided. You know, and again, those toxic stressors that minority communities face, members of the LGBTQ plus community are exposed to and have to deal with a lot of a number of toxic stressors as well. Just in, am I going to be treated fairly? Am I going to be recognized as who I am? Will my partner be recognized as my caregiver? And, you know, can I be myself in this environment? So there are a number of different toxic stressors that this particular community faces as well.
Mm-hmm. Mm-hmm. So you mentioned having a community advisory board. Is that how you refer to it? I want to make sure
Yeah,
that that's the right term.
community
Okay.
advisory board.
Okay. Good. I know that there's different terms used in
Yeah.
different settings. So how did you identify people to serve on this group?
So we have a few employees here at the Cancer Center who are members of the LGBTQ plus community who graciously volunteered to work with us within the larger community to identify individuals to invite to an initial focus group meeting. And so we hosted it at a local restaurant and provided light refreshments and just had a basic conversation with some members of our workforce that identify as LGBTQ plus, and they had invited advocates and allies as well as other members of the community to participate in this focus group. Mm-hmm. So that's how we kicked it off. And now they have become our advisory board. They all graciously agreed to serve on our advisory board. So you have representation from everyone from consultants who operate in their employment as consultants, attorneys, restaurateurs, waiters, waitresses. We have several allies that attended and are participating. So we have a very diverse group of individuals that are serving in this advisory capacity from the community.
Okay. Now, can you tell me a little bit more about the members of your research team? What's the who's the composition, and perhaps specifically given the population that you're working with, the members of your research team that may identify as LGBTQ plus?
So we have engaged Dr. Mandy Pratt Chapman from the George Washington Cancer Center in Washington, D.C. to serve as an evaluator on our program.
Okay.
So she is working with us and she identifies in the LGBTQ plus community. And then we have our medical director of clinical research, Dr. Victor Lynn, and my director of research, Mandy Ship. And then, as I indicated, a number of our employees, our director of communications and senior director of communications, Scott Miller, who identifies in the LGBTQ community. He is working with me on the marketing and communications piece of our research. Okay. Because part of the research we're doing is how to best market to this particular community, and ensuring that our marketing materials lend themselves to individuals recognizing that we are a safe community, a safe environment for them to get care in.
Okay. So what type of data are you planning to collect over the course of your research project?
So part of our research project involves working with the developer who created our database to collect all of our screening data. And so they are assisting us with adding mineable fields into our database whereby we can collect gender, gender identity, and sexual orientation.
Okay.
And also creating working with us to help a different developer from a different grant to create a microsite which can direct members of the LGBTQ community to where we will have information specific to that population of people. And so they will feel more comfortable going there. They will feel more comfortable asking questions there. It's a safe environment for them.
Okay. So, another question that I have that I mean, it's definitely rising more in interest in research is the idea of intersectionality. Now, I know that you probably already collect data on race and ethnicity as part of your fields, and now that you're going to be adding new fields as well that will have information about gender, gender identity, and sexual orientation. Do you plan on looking at how the intersection of race and ethnicity and um, identification as part of the LGBTQ plus community affects people, specifically affects how people uh, engage with cancer screening and care, education and care?
Yes, our database will allow us to drill down into all the way down to zip code level, whether or not they're insured or uninsured, what type of screening they received, where they received the screening.
Mhm.
Because we currently serve 31 parishes in Louisiana and 4 counties in Southwest Mississippi. And so there may be locations that we go to that may be a safer environment for someone to go to as opposed to another. To give you an example, we had an event on this past Saturday at the Hispanic Apostolate, which is a local church.
Mhm.
um, and while we do have members of the Hispanic community come to our screening events all over, um, many of them wait until we have the event at this particular location because they view it as a safe haven for them to go to and get those necessary cancer screenings because we have interpreters there. We have um, all of our marketing materials are in Spanish and geared toward that particular community. So we'll be able to drill down in our database to really see where members who identify in the LGBTQ plus community, where do they actually go for our screening services so that we can tailor our program more to accommodate those needs.
Okay. So, with all that in mind, can you tell me a little bit more about what drew you to the PTech Health and Equity Research Grant Program?
We viewed it as an opportunity to be able to be prepared for what's to come.
Mhm.
And as we see our LGBTQ plus community growing here in Louisiana, we've over the past 20 years in our screening and education program, we've overcome a number of different challenges, both internally and externally, because several years ago, many years ago now, um, when we required staff to ask individual community members their race and ethnicity and not eyeball it, you know, um, we had a lot of pushback from not only our staff, but also the community. And why are you asking me this? Why do you need this information? And so we anticipate the same thing when we begin to ask gender and gender identity.
Yeah,
But
yeah.
what we have found is that it's important in overall cancer research from a lot of different perspectives. There is no data on cancer incidence, mortality, screening, anything of significance about the LGBTQ community. The data is not there because we're not collecting the data. There was not significant data about the participation of minorities in screening or clinical research trials or anything like that until within the last 20 years because we weren't adequately collecting that data. We were eyeballing people as opposed to asking them their race and their ethnicity. And we still get pushback on that. You can look at me, you see what I am. No, I don't. I
That's
can't.
right.
I have to ask. And then we have to explain why we ask. We're contributing to the body of science. We're contributing to something much greater than this one cancer screening that you're getting. This data is going to be used to help drive additional research that can possibly lead to cures in cancer. And then people get it and they provide the information. So we recognize that there was very little data about cancer screening, education of the LGBTQ plus community. And so we viewed this PTEC grant as an opportunity to begin to address this in the communities in which we serve and hopefully to make an impact in the long term.
So I just, another question here. Do you I know that you have a community advisory group and you've been working with them. As you go into the community more working on this research project, do you anticipate any difficulties with regards to asking people about their gender identity, and sexual orientation, given the sort of charged environment we're in right now?
Yes, we do. We
Mhm.
do. We have been providing our staff with training. We are continuously identifying other opportunities for them to receive training. We have identified members of our team that are allies of the LGBTQ plus community, and we are utilizing their expertise and knowledge to help work with us to educate other employees. This was one of the first years that we as an organization across our entire enterprise recognized Pride Month in June
Mm, okay.
and provided employees with a token to help recognize Pride Month. It was a rainbow bracelet and to pay homage to the community we serve as well as to our employees that are members of the community. It was well received by most. Yeah, I'm sure there was some pushback by others, but by and large, it was very well received. We participated in two different local Pride Month activities in
Oh,
June,
that's great.
and so did education at that event. And some of our employees were heckled by protesters as they were, leaving the event and that type of thing, but they stood firm. And so we do anticipate that we're going to have to do a lot of training for our team members. And then we do anticipate that we're going to get some pushback in the communities we serve, but we're going to stand fast and move forward because um, whether you're a minority, whether you're a member of the LGBTQ plus community, whether you're a non-minority, whether you're a green person with a horn in the middle of your head and a rainbow jacket on, you still need to be screened for cancer. And we just want you to get screened. And so that's our primary objective. We're here to serve all.
That's a really excellent message. I think a lot of times people in the LGBTQ plus community feel isolated from
Mhm.
the healthcare system, from the community health system, from public health, and having a more inclusive message, especially going to pride parades, again, pride events, is a really great way not to just show yourself, which I think you're doing an excellent example of showing what it means to do health equity, but also so that people see you in a safe space. And so when they
Correct.
see you out in the community, they can make that connection and feel that this is an investment, much like what you would see with racial, ethnic, I hate the term minority, people of color. We don't have a good term yet, but you know what
Yeah,
I mean.
I know what you mean. Yeah.
Yeah.
And we actually have an event targeting the LGBTQ community later this month where we're going to be providing screenings at a local safe environment church in our community that serves the LGBTQ plus community. And we're going to have a screening event there. And so super excited about it. And hopefully we'll get a good turnout of individuals from that community coming to get screened.
So we've talked a lot about your investigation, about the population that you will be working with, and you've said here and there about the type of knowledge that you expect to gain from the investigation. Um, so moving forward with this, what do you foresee as your next steps once you've collected the data from this project and assessed your efforts in terms of education and screening? What's the next step for Mary Bird Perkins Cancer Center in working with the LGBTQ plus community?
Our next steps will be to continue those efforts,
Hmm.
to continue to reach out to the LGBTQ plus community um, so that, God forbid, any of those individual members of that community have to seek out cancer treatment services,
Hmm.
they will know that this is a place that cares about them. This is a treatment facility that cares about them as an individual, cares about their individual needs, cares about um, their loved ones and caretakers and partners, and want to make them feel welcome. And so we will continue those efforts. We will continue to have targeted outreach to the LGBTQ plus community. We have identified a couple of local federally qualified health centers in the community that serve the population, and we will continue to work with them on an ongoing basis to reach those individuals. And as well as working with our own employees internally, because I think that
Hmm.
sends a very strong message to individuals to understand and know that we value all of our employees. And so we want to highlight them and make them feel um, part of something much larger than what they are, and utilize their intellect and know-how on how to reach this population of people.
Okay. That sounds fantastic. I think, it's really important to have employee buy-in and as well as community buy-in for these types of projects to work.
Mhm.
Now, have you been thinking about a dissemination plan, how you plan to share the information that you gather over the course of this research project with the larger research community, healthcare community, LGBTQ plus community?
Quite honestly, I have not gotten that far just yet. But it would be great. We participate in a number of different national organizations. I'm on the board of trustees of ACCC, the Association of Community Cancer Centers. I
Mhm.
would love to submit this as an innovator um, project to
Mhm.
ACCC to be awarded an innovator award for our work in this area. Um, and then also there are a number of other health equity and disparities conferences that we participate in where I'd love to do a poster presentation to share the data at those as well.
Mhm. Yeah, that's the one thing that we really find a critical part of our grant program at Tech is making sure that this information gets out to as many people as possible. As you probably are well aware, a lot of research ends up behind paywalls where no one ever sees it, or it is confined to a privileged few, and that really restricts innovation in healthcare delivery and health services research. And this, as you said, is an area of study that is sorely neglected. And so, thinking about how we'll get this information out to people who not only are very interested in having this information, but also people who maybe have never thought of it before, who maybe have not considered how they interact with people in the LGBTQ plus community in healthcare settings. As you pointed out earlier, for example, people in the trans community who have retained the organs that they were born with, a lot of times they are not part of outreach messages. They're not part of messaging campaigns. I mean, if you can think of October with breast cancer, awareness month, if you are a trans person who has retained their breast, none of that messaging is for you.
Right.
And so that's the kind of thing when we're thinking about providing grants, we're really thinking about how important is this information for the greater community and how can we help people get it out? So as you're going through the course of this grant, we really hope if there's something that we can do to help you get your message out, you've already named a lot of places that you'd like to start, but if there's anything we can do to help identify other outlets, any resources that we can provide, that's one of the other important things that we try to do is try to facilitate these messages getting out there and making change.
Mhm.
Um,
If you notice, I did not mention any LGBTQ plus specific type organizations
mhm,
for which there is a cancer network for LGBTQ plus and others like that. And I think those are awesome. They've been a great source of information for me in the work that we're doing here. But we have got to mainstream this information in order
correct.
for it to be effective. Um, you can sing to the choir at church all day long, but until you sing to the community, you're really not going to change that many lives. And so we've really got to make this information more mainstream and get it out there um, in other publications, other mechanisms that it's going to
Mhm.
reach more people.
That is exactly what we're trying to do with these grants. And, it's not a ton of money in
No,
the grand scheme of things,
but
but
it's a tremendous help because it's enough money to help us get started. And a lot of
exactly.
the times that's what's missing is we need a kickstart. And so it's enough to help us get started by transforming our database to be able to collect the data. And once we're able to collect the data, then we can begin to do even more. But you
Mhm.
don't know what you don't know. So,
Exactly. And that's, I would say definitely that's something that really appealed to me. It's like we really don't know this information. How do we get this information? And, if we can help pay for that,
mhm,
that gets you on your way. And, it's an underserved community within an underserved community, within
right,
an underserved region of the country. So it's like
right,
all of these nesting dolls. And if this little part can make a difference in what you're doing, I mean, you've got a pretty large geographic footprint as for your organization. And if we can help in any way, and I'm glad to hear that we can, and that your project is really innovative, very interesting, and it's something that I think, even though we are talking about LGBTQ rights more and more, we're not talking as much about the nuts and bolts of healthcare. We all have bodies, and it's just a matter of how do you communicate with people that you have to care for all of you in a sensitive and caring way of and showing that you're investing, not just kind of dropping in and dropping out. And that sounds like exactly what you're
right.
doing.
We're not using this grant as an opportunity to drop in. We're
Mhm.
moving in.
Mhm. So do you have any final comments or thoughts that you'd like to share, either about your project, what Mary Bird Perkins does, anything like that?
I think the final message that I would like to leave would be early detection does save lives, and all lives matter when it comes to your health care. And so we want people to recognize that you have to understand and know that you need to be screened for cancer. You need to know where you can get screened for cancer. And then you have to, as an individual, no matter which community you are a member of, you have to want to be screened and you have to go out and access that. And we want to be able to continue to provide access, especially to those who are marginalized, those who have suffered biases, those who are in disparate populations. We want you to know that we are here to help provide this service for you. And not only do we screen you, but if you have an abnormal finding, we're going to help you reach resolution of that abnormal finding. We don't just screen you and leave you. We find something wrong, we're going to help you figure out what it is. And so we want people to recognize and stand up and take personal responsibility for your health and seek out these services, whether you are, as I said earlier, whether you are black, white, green with a unicorn in the middle of your head and a rainbow jacket on, or a member of the LGBTQ plus community. Take responsibility for your health. Get screened for cancer because early detection does save lives.
Well, I couldn't have ended this any better myself. So I'd like to thank you for joining me today, Renee Duffin with the Mary Bird Perkins Cancer Center. Um, it's been a pleasure talking to you and learning more about your project. It sounds absolutely fantastic, and I'm looking forward to hearing more about it over the course of the next 6 months, 8 months, and
Months.
forward from there.
Okay. Sounds great. Thank you so much. We appreciate
Thank
this
you.
opportunity.
Thank you. You have a good day.
You too. Bye bye.
Bye.